Hey everybody, my name is Dr. Brady Wirick. Welcome to this episode. We're going to cover Rebuild, Don't Replace, the future of healing with regenerative medicine. Again, my name is Dr. Brady Wirick. I've been in practice for about 20 years, and I've practiced chiropractic, functional medicine, functional neurology, and regenerative medicine, helping people live fuller, healthier lives and doing it all naturally by getting to the root of the issues, getting rid of drugs, etc. But the regenerative medicine story for me started in about 2018. The first person we ever injected was actually my dad. He was scheduled to have both of his knees replaced. We took umbilical cord stem cells. We injected those into his knees, and he actually canceled his appointment for his replacements and literally lived the rest of his life on knees that were about 80% better than they were. That's him in the back of the boat with the orange jacket fighting a fish, doing what he loves. And it was an honor to see that unfold. Unfortunately, he did pass away a couple years ago, but he did it on good knees. So what if I told you that surgery, when it comes to joint pain, surgery is not your only option? What if I told you that you can actually, your body can actually rebuild itself regardless of the age? That's exactly what we're going to cover, is how regenerative therapies are reshaping the future of medicine. For guys like Gary that you see on the screen there, Gary is pushing 90 years old. He's an avid hunter. He loves to get out, and we put stem cells in his knees, and he's keeping to do the things that he loves to do. And it's been an honor and a privilege to take care of him. What does stem cell therapy do? What do we use this for? Well, if it ends in itis or osis, and we can put a needle in it, we have a really good chance of helping it. What you actually see here is our medical staff, we use a nurse anesthetist, his name's Corey. He's actually injecting the joint right here at the base of a patient's thumb to help it regrow new cartilage, so that person doesn't have to have that particular joint worked on. So why is the traditional medicine, the model of medicine, failing? Well, here it is. Hey, when your joint starts to hurt, you take the over-the-counter stuff. When that stops working, you go to the doctor. The doctor gives you cortisone, which gives you short-term relief. But doing that over and over again is actually going to cause long-term damage. And I often call cortisone injections, we call those the fast track to replacement therapy. So you take the NSAIDs to manage your symptoms, but it doesn't do anything about the causes. And then unfortunately, we do surgery often either too little or too late, and we don't get the full benefit out of what we want. And then there's the whole thing about pain management and profit. If you're hurting, they're going to make money in maintenance, not in actually healing the tissue. So what is regenerative medicine, and what role does it play? Well, we're going to do everything we can to stimulate your body's natural healing repair mechanisms. It's non-surgical and it's minimally invasive. And we use what I call, and we're about to share with you, which is the secret sauce. We're going to use these biologics to help your tissue, help your body grow new tissue. That happened with Glenn here. Glenn is one of my buddies that he actually lives here in Southeast Idaho. He works for the power company by day, and he is a crew chief on a Black Hawk helicopter for the Army by night. We started with his shoulder, which he needed to have replaced. He couldn't do the push-ups to pass his physical so he could fly. We fixed that by using stem cells, and we've done a knee and an ankle for him, if I'm remembering that correctly. But he responds very, very well to these therapies, and he gets to keep up in the air, which is where he wants to be. So what is the secret sauce? The secret sauce starts with platelet-rich plasma. This is only an option if you're under 50. Umbilical-derived stem cell products, stem cells, and exosomes. I'll show you this picture of Pat. We injected her about 7 years ago, and I kind of lost track of her, to be honest. And just out of the blue the other day, she calls me up and says, "Hey, I finally found you, and I just want to tell you that I'm doing awesome." So that was such an honor for Pat to actually just call me out of the blue and say, "Hey, thanks, we're doing great." So let's explain each one of these. PRP is your own blood. We take your blood out of you. We put it in a centrifuge, which you see in the back of that picture, that white thing. We spin it down. Your red blood cells sink to the bottom. So that's my thumb, right above my thumb. You see the dark red, that's red blood cells. Then you see that waxy looking thing. Hey, that is a filter. And then on top of that, the yellow stuff is the actual plasma where all those growth factors and cytokines are residing. Those growth factors and cytokines are what your body uses to signal a cell response, but there are no stem cells in PRP. And it is age dependent because it's coming right out of you. So as far as stem cells are concerned, what we used to think is that if you take a stem cell, it's an undifferentiated cell, and your tissue will actually stimulate those cells to become new types of tissue. We now know that's not necessarily true. It's all about the signals that those stem cells secrete, which these stem cells that are very, very FDA regulated. And then we have exosomes, which are the actual what the stem cells are releasing. They're the messaging molecules. So you have they're anti-inflammatory, and they have a regenerative effect. And we use them for very, very cool principles. So let's bust a couple myths. PRP does not contain stem cells, but neither does BMAC, which is bone marrow aspirate. There's just recent studies about BMAC have come out and say, no, there's no stem cells in there at all. That's bone marrow stem cells. They decline with age. Hey, they're not as effective, so what you end up with is overpriced therapies that don't perform like umbilical cords do. So umbilical tissues does not mean unethical sourcing. We get all of our products from labs that are on the up and up with the FDA. Now, guided injections. This is the other part of the secret sauce, right? What really matters when it comes to regenerative medicine, the secret sauce is, what are we using, number one, and where are we putting it, which is number two, because we can use the best products on the planet, but if we use it in the wrong way, it's not going to have an effect. So this is why I'm a big, big fan of guided injections. We use ultrasound with all of our injections because of their accuracy. We can target joints, ligaments, and tendons. Bottom line is we just don't guess, we guide. What's really cool about ultrasound is, MRI is still the gold standard when it comes to imaging, right? So you go get an MRI, shows exactly what the tissue's doing. But that only shows us at that time and in that position when you get that MRI what's happening. But with ultrasound, it's actually real time. We put that on there on the day of injection, we find where the inflammation is, and then we actually watch the needle go into where it needs to go to make sure we're delivering it efficiently. This is really, really great, especially with the smaller joints like your wrists and your elbows and your ankles, etc. So this is how we do it on the daily. And then we have the route of administration, which is via IV, or to actually nebulize these things, which is to take a powder, put it with saline, and turn it into a mist so you can breathe it in. We do this for systemic inflammation. IV exosomes are going to support your whole body inflammation, and they're going to regulate your immune system. Nebulizing it makes it so you breathe it in through your nose, which is going to target your brain. It crosses your lung-brain barrier, so it's great for lungs and your immune system. And this is an excellent, excellent option for chronic inflammation in autoimmune conditions with autoimmune conditions and brain fog. So it's non-invasive, it's fast-acting, it's well-tolerated. So here is what to expect. Hey, you're going to expect to see pain relief in the first day or two. A lot of people that walk out of the office feel better that day. That's my man James. He came in. He actually slept better the night after we injected him, which was awesome. But peak healing is going to happen about 6 to 8 weeks. But you got to keep in mind that long-term results are going to vary. How long is it going to last? We can't tell you that. We can't look in the eye and say, well, it's going to last 5 years. We just don't know that. Okay? Everybody's different. It's going to depend on how you take care of yourself because you have an active role in getting the best results. And here's how you do it. Okay? I'm going to highly recommend that you do an anti-inflammatory, high-protein diet. Now, don't worry. I will give you recommendations on how to do this, but that's where you start. I'm going to recommend that you supplement with collagen. I don't have one collagen over the other that I recommend. Just get some collagen, get it from natural sources. Light movement for the first 2 to 3 weeks. So we don't want you to get an injection and then be bedridden for the next month and a half. It's get an injection, and that day we want you to start using that joint, moving that joint, just making sure you're taking it easy. We do want to avoid twisting and loading for the first 8 weeks. So skiers, don't do this in November because you're going to miss your season. Hey, we want to make sure we time that correctly because you definitely don't want to twist, and we want to be careful and not start any new exercise program. Healing is not a passive thing. It's you are actually part of the process, and there are ways to do it. And we actually give you material when you do your injection so you know exactly what we're talking about. So you can be like my dad here and be on 2 knees that were supposed to be replaced without doing yard work, pushing the wheelbarrow around. So here we are entering a new era of healing where we rebuild, we don't replace. Hey, we're not like Michael Scott here where we're trying to stick our foot in the MRI machine as Dwight's getting an MRI. Hey, we're going to reduce inflammation. We're going to signal repair. We're going to restore function, reclaim your health without going under the knife. These injections at our office start at $650. We have people flying in from a lot of places to do this right here in good old Southeast Idaho. So are you a candidate? Well, visit truecorelabs.io. You can call or text me at 208-218-8622. Let's talk about your options. So don't just settle for surgery before exploring these other options that are out there. That's all I got for you for this episode. Thank you for hanging in there with me. We will see you next time.